Good evening, everyone, and welcome to the special radio show with Dr. Doug Thompson. With over 25 years' experience in state-of-the-art oral health, Dr. Thompson will be talking to us about the serious connection between gum disease and most of the major diseases of our time. He will tell us about where his research has led him with respect to avoiding these silent killers. He's joining us tonight in this rare opportunity to call in and speak with the doctor directly. You won't want to miss what Dr. Thompson has to say, and if you have a question for the doctor, we're inviting you to call in at 800-859-0957. So stay tuned, and we'll be right back after this short break. You're listening to 760 WJR. Welcome to Facebook. So I'm very happy to have you here.
Thanks, Anne-Marie.
Dr.
It's
Thompson.
nice to be here. Thank you.
What are we going to be discussing on the show tonight? What are we going to be talking about?
Well, we've talked in some of the shows past about oral bacteria and some of the things that we can do to identify gum disease and identify cavities and the bacteria that cause cavities. But tonight, maybe we should discuss a little bit about cognitive decline and Alzheimer's and dementia, and where dentistry fits in with our ability to help figure out who's either having trouble or who could be in trouble. And so Alzheimer's and dementia would be a fun thing to maybe talk about. But there's a lot of other areas beyond the mouth that we haven't yet discovered. Diabetes, the significance of certain lifestyle factors that play into the disease processes, like poor nutrition or lack of exercise or dehydration or stress or no sleep. These are all things that are also important. So we can take it any direction you want, but I think I would love to have some, callers from Facebook. That'd be amazing if we could have some Facebook
we'll have
callers.
Some, people that want to.
That would be nice. So let's ask some. Let's get some questions and.
Right, anyone that's piping in on Facebook, absolutely.
Let's take it where they want it to go.
Absolutely. So.
So that's what I'm thinking.
Welcome to the special live radio show where you can call in with your questions and talk to the doctor directly. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Doug Thompson, integrative oral health dentist from Bloomfield Hills, Michigan. He's here with us discussing his state-of-the-art clinic, the latest diagnostic systems in oral health care, and the importance of the connection between the mouth and many systemic diseases. If you have a question for the doctor on the matters we're discussing tonight, please call us at 800-859-0957. Dr. Thompson, welcome back. It's always a pleasure to have you on.
Thank you.
And we all know by now that you're part of a very small minority of dentists who provide overall diagnostic measures for healthcare diseases, pre-existing conditions that even your primary care physician is not doing. So tell us just a little bit more about how a new patient coming in, what is the first thing you're looking at?
Yeah, it's thank you first off for having me. Our normal shows are on Sunday and are some Wednesdays, so it's really a privilege to be here on a Tuesday night. So thank you for having us.
Fabulous, yes.
Here. One of the things that traditional dentistry has done is dentists have been compensated, obviously paid by insurance companies and patients to drill on teeth and to fix fillings. Well, I thought, how cool would it be if people came to me and they had risk factors, or they had maybe even a susceptibility to a disease, but what if I could prevent that disease so that I didn't have to drill in their teeth? That'd be kind of cool. So one of the things that we like to do is make an assessment when patients come in about different areas of their dental health or oral health, if you will. And what I would like to do is, instead of just doing a lot of reparative dentistry on patients, I'd like to do kind of a risk assessment analysis and figure out, who could benefit from some information about preventing gum disease? Who could benefit from some information about preventing cavities? Who could benefit from information about how to be healthier in a number of key areas? And that's really become the focus of our practice. So it's not so much on what do we need to do to repair you? It's what could we do to help prevent you from getting into a situation where you need repair? That's kind of a cool deal. And that's a different philosophy for a lot of us dentists. And so when patients come in, they're going to go through an assessment process where we figure out what are they most at risk for? What have they struggled with most of their life? And I can tell you, if you're a patient that has had multiple cavities, or you have a cavity every time that you go to the dentist, or you have gum disease, we now have methodology to identify and to stabilize those diseases so you don't have to have that repetitive cavity fill. Anne-Marie, there's something really interesting. And if you have any additional questions about anything I've said so far, please just
Yes.
let me know.
Mm-hmm.
But I can tell you, there's patients that used to schedule a hygiene appointment. That would be a regular tooth cleaning appointment.
What we normally expect when we see a dentist, the normal hygiene, which is done by hygienist.
Correct.
Right. Uh-huh.
And then you know what they would do? They would schedule 20 minutes in my schedule afterwards, because they knew every time they came in, they would have to have some kind of little repair procedure afterwards.
Mm-hmm.
That's not what we want to do.
Right.
I don't want people coming into my practice that need repair after they see the hygienist. I want patients that come into my practice that have no disease. They have perfectly stabilized disease if they had disease, and they see the hygienist. It's a nice experience for them. And they don't have to come into my chair and do work. But I can tell you, to get a whole boatload of patients that have that kind of condition, it takes a lot of skill, care, and judgment to figure out who needs what and who doesn't need certain things. And that's what we do in our practice, is do this risk assessment. The idea is to eliminate that disease before it becomes necessary to do repair. That's the goal.
I think it's pretty amazing, because I think that people have fallen into a dark hole following COVID, during COVID, because even although we may have limited access to our doctors before, we have hardly any access now. And getting in to see a specialist, or going in for just, prevention or diagnostic tests, has become literally almost impossible. And I think that you developing this healthcare preventative dentistry program, of very few dentists are doing it, and it sort of bridges the gap between dental care and medical care, because you're actually able to, through the testing you're doing, identify some of the most serious diseases of our time.
Well, there's no question. And so, why don't we embrace the fact that, hey, it's a little bit of a new concept, but I can help educate the population. That's what you're helping me do with our reach on WJR. I mean, I love the fact that we have this really broad reach. And I think that we can start to let people know that there's other alternatives out there. You don't have to go through the old traditional system, and you can start to network with like-minded professionals that have a unique perspective about how we identify early disease and how we stamp out that disease, and how we can really prevent a whole lot of uncomfortable hospital experiences. We can prevent a lot of uncomfortable operative experiences. We can do amazing things for people, but we have to be able to do this initial assessment, and we have to be able to do some basic testing. That most of this, by the way, is quite inexpensive and very easy. And we can do this testing to identify what are the major problems that you're facing. And what I realized when I started to really go down this road is everybody has their own personal journey with health or disease. And what I would love to do is come back after the break and talk more about what we can do, because it's an amazing opportunity for us.
Come back and talk about those diagnostic measures. In the meantime, we're going to have to take a quick break. You are listening to the Dr. Thompson radio show, and he is here tonight talking about the seriousness of undetected oral pathogens, which can be the root cause of many catastrophic diseases. If you have a question, you can call us at 800-859-0957. Again, that number is 800-859-0957. You won't want to miss this chance to talk to the doctor directly. You're listening to the Dr. Thompson radio show on News Talk 760 WJR. And we are back on Facebook.
Yeah, and one of the areas that we can really have a major impact on patients is I have learned that cognitive decline, the ability for you to start losing your memory can happen in your 40s. It could even happen in your late 30s.
That's a sad remark.
Yeah, no, it's true. So if you have the wrong kind of bacteria in your mouth, that can affect your vascular health and your brain health. You would want to know that. And so we have some really unique testing that we can do to help figure out who's maybe at risk. Not only just looking at family history, but looking at certain things that we can measure on people themselves. And I just think it's time for all of us to know a little bit more about the makeup of our own oral microbiome, and what do we have living in our mouth, and what could be there that could be, really affecting our cognitive health and the ability for us to decline quickly over the years. And, one of the things that's unique, and I'll have a hard time to say this on the air, but since we're on Facebook Live and we have videos of us, one of the two of us, Anne Marie, are going to have Alzheimer's or dementia.
Don't say that.
No, one of the two of us.
Oh my God.
But here's the problem. No one's escaping this disease, because if it's me that has it, then you might say, oh, I think he's going to have it. But you know what? You're going to be dealing with somebody that has it. So the idea is whether we deal with somebody or whether we have it, we all have to manage this travesty. And if we could do anything in our health history, anything in our health, anything in our life to help prevent this issue, what a blessing it would be if we knew that in advance.
No, absolutely. And I think people don't realize, they don't know about dementia. It's out there. We think about it as belonging to the 80-year-olds and something that happens very late in life. And then it's a crapshoot whether or not you're going to get it or somebody in your family is going to get it. But I think that it's something that's very hidden that we don't think about. And certainly most people don't know that it can be prevented and that you can get it a lot earlier than what you think.
We can do some basic genetic testing and figure out who's really at risk. And if you're really at risk or your family's really at risk, man, what a great opportunity to take some early preventative measures so that genotype, your genes, don't have to become what you ultimately, what ultimately transpires in you. What a great opportunity.
Terrific. Welcome back to the Dr. Doug Thompson live medical radio show here on WJR. I'm your host, Anne Marie Cronin, and we are here tonight talking with Dr. Thompson, general dentist and oral health specialist in Bloomfield Hills, Michigan. He's with us discussing the latest diagnostic methods he uses to diagnose many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor, please call us at 800-859-0957. And also welcome to the Tuesday night listeners. All of you, this may be the first time you're hearing Dr. Thompson weigh in on his practice, which is, as I like to call it, a medical dental practice. And Dr. Thompson, tell us a little bit more about, we were talking about over the break on Facebook, and we stream live on Facebook and YouTube. So please, listeners, tune into that as well. But we were talking about dementia, and you were mentioning that we tend to think about this as happening when we're very old, whereas there are people who are 30 years old that may wind up coming down with dementia. And it's a long, hard journey, not only for the sufferer, but for the family who's taking care of the person afflicted. And here we are nowadays with all the technology that's available in practices like yours that do pre-diagnostic testing by being able to just open your mouth, look into the oral cavity, and you can actually find out all kinds of pathology in there that we can eradicate before it gets into the blood system. Please talk to us about it.
Yeah, well, when I went through dental school, and, I'm not a super young practitioner, so I have quite a bit of experience. But when I went through dental school back in the mid-90s, we were not even talking remotely about how oral conditions or oral pathogens like bacteria, yeast, or viruses that live in your mouth, we were never even talking about how that could cause something like dementia. We thought it could just cause gum disease. Well, what we started to learn as the microbiological world and the scientists got more sophisticated with what they know, we know now that there's certain situations in your mouth or certain bacteria, yeast, or viruses that live in your mouth that are responsible for up to 57 other diseases. But one of the big ones, one of the big diseases is Alzheimer's and dementia, diabetes, heart disease. These are really major ones. And when you think about somebody who has experienced cognitive decline, dementia, or early Alzheimer's disease, these are really debilitating diseases on families. So what I learned recently is, and I mean within the last 5 to 10 years, is that there's certain oral conditions and certain oral bacteria that I could measure for very simply, plus a little bit of a genetic test that could alert me that maybe somebody could be at risk for this. And if somebody's at risk for this, what I needed to figure out was to develop the skill to figure out how to suppress or either control that bacterial population so that this didn't become as significant as an issue as it would be if I didn't do my job. And I learned that I have an incredible opportunity because we can actually, our hygiene team, we have people in our practice that are called hygienists, and everyone knows they have a dental hygienist. I actually call them periodontal therapists, which is a much more sophisticated term because they do way more for you. In my practice, they do way more for you in identifying at-risk people, at-risk conditions. And if they do their job really well, they alert me as to who might be at risk, and they can be amazing at helping me figure out who needs to have a test or a diagnostic opinion about what could be going on in their mouth. And we could actually be significant in delaying the onset or helping mitigate some of the risk factors that cause Alzheimer's and dementia disease. I never thought that would be possible from looking in your mouth or from doing something in your mouth or for me as a dentist. It's not something I even thought about, but it's an amazing opportunity. And what I'm trying to do is help educate the population about what we can do for them. And I'm happy that you're helping me do that as well.
Well, thank you. And I think about this all the time, and I realize that, technology has taken us along very quickly and in doing these investigative tests. But who would know, among all the dentists out there, and when you went to dental school, people would go in to sit in the dental chair, and it's basically to get your teeth drilled or scraped and cleaned and polished and x-rayed. And you're not thinking about what is growing in my mouth that has this killer potential. The connection between the oral pathogens and heart disease, for example. Look at how many people get cardiac disease and eventually die of heart disease because doctors don't find it until you have symptoms. You're able to find it before you have symptoms. Likewise with all these other diseases, and thanks to, technology such as the Gallery blood test that diagnoses 50 other potential diseases from the pathogens that are either in your blood or in your mouth, that we're able to, and you've taken on that task, to take a look at what they are and analyze them. Tell us a little bit about what you do when you look into a patient's mouth. How do you handle, what happens from when you look into their mouth and you start to, do you take a swab or what do you do?
Yeah, we see clinical signs. First off, let's just say, let's make it easy. We see some hints. When our hygiene team, our periodontal therapists look in, when we look in as doctors, myself and Dr. Watkins, we look in and we see clinical hints that something might not be just so right. And when we see that, we start to get more inquisitive. And at that time, we would offer the patient some options. Hey, we have this test that would help us really further identify or clarify what it is that I see. And I think that would be an amazing opportunity. And you can interrupt me at any time if we have a caller on the line. That would be great. I'd be happy to take that call.
We'll come back to this question.
Okay.
We have Alan in Clinton Township. Alan, what's your question?
Can't hear her mic.
Alan in Clinton
Yeah, we
Township?
have Alan from Clinton Township, and
yes,
maybe Alan's going to ask us a question.
What is the question, Alan?
Hello, my name's Alan. I'm calling from Clinton Township.
Yes.
I'm a retired dental laboratory owner, and I want to know why there are no requirements to open up a dental lab other than you have to have a legal prescription from a legal dentist, and why there are no dental technology schools in Michigan.
You know, Alan, it's funny that you asked that question. Did you know I was a crown and bridge technician for 12 years before I was a dentist?
Well, he knows now.
Yeah.
I mean, Alan, this is a sensitive question for me. But Alan, what you're alluding to is a really, really good question, because when people go into a dentist and they get a crown, or when people go into a dentist and they get a denture, or people go into a dentist and they get a partial denture, they have no idea where that comes from. They have no idea where the dentist gets it from. And, you know, the range of costs for me as a dentist could be anywhere from $36 for me to pay for that crown that I put into your mouth that I charge you $2,000 for, all the way up to $750 or even $1,000 from a very high quality custom lab. And the consumer has no idea where that comes from. They have no idea. So, Alan, you know, this is a conversation that I don't know that we should probably have on the radio, but I can tell you that the consumers out there should be asking their dentist, where are my crowns made? Where are my prostheses made? What kind of materials are we using? Because you're absolutely correct. Alan, you've put your heart and soul into using the best materials, using the best labs. And right now, unfortunately, dentists have some very cheaper options. And you're correct. This whole industry should be regulated, and it's not. Well, not regulated, but it should be. We should have high integrity for what we do, and it's not. And I can tell you, we only use, I'm proud to say, we use the best materials. We use U.S. Dental technicians. Most of it's being done by computers right now. It's a brilliant question. It's actually kind of broadsided me a little bit because I never expected this kind of question on the radio, but it's a great one, and it's something that consumers should know. You should ask your dentist, where are the prosthetics that's being used in my mouth made, and what kind of materials are they made from? That's a brilliant question.
Yeah, it's amazing. Who would think about it? We just put so much trust into going into the dentist, sitting in the chair, opening your mouth and letting them drill away, and you don't know what's going in there. But in the meantime, we're going to have to take a quick break. You are listening to the Dr. Doug Thompson radio show, and we are talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you can call the doctor directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on News Talk 760 WJR.
That's a whole nother issue. What Alan just mentioned is a whole nother issue. Like, where do we get like when I do a crown for somebody, like, where do I get that from? Oh my gosh. Dentists have been and I'm sure we're probably on Facebook Live right now, so I want to talk to our Facebook audience, but dentists have probably been so cost conscious, and there's so much financial pressure on our practice that some of the dentists are getting these crowns from different types of places that allow them to come to them very, very inexpensively. And I can tell you, beware. You want to know where your dentists are getting that stuff from, because it's amazing what can happen.
I see Siobhan, you just
Hey,
came. Well,
Siobhan.
hi Siobhan. Where have you?
Hi, Dr. Thompson. I'm joining in from Charlotte, North Carolina
Awesome.
today. So
Thank you
glad
for
to be
taking
here.
the time to join in.
Of course, it's my pleasure. Great to be here.
Where have you been for the last past half hour? I've been looking for your face. Where
I know,
have you
just
been?
Finishing up a concert.
Oh, you
Finishing
did?
up a concert today.
Okay.
Yeah.
Sounds good. Well, we're glad to see you. Did you catch the last comment about the apparatus that goes into your mouth?
I just want to do I get a chance to plug Siobhan Cronin?
Yeah,
I mean,
go ahead. Go ahead.
Oh my
I
gosh,
love it.
thank you.
I mean,
this
if-
is not even
if-
my
Go ahead.
show. Thank you.
I know that it's not your show, but if you're a listener to this show and you haven't heard music, Siobhan, tell us where they can find your music. It's amazing. You're an unbelievable
Yes.
talent.
Thank you, thank you. Well, my name's Siobhan Cronin, but I play with a band called Starset, and you can look us up, starsetonline.com. We're on YouTube, Spotify, Apple Music. We're on a tour right now. I'm doing an acoustic tour at the moment. We have a few shows left, so if anyone's listening, we're making our way back to the Midwest. So we're going to be in the area that WJR reaches. So we're finishing up a tour this week, but we tour, yeah, every year throughout the U.S. We go to Europe, but yeah, our music's available everywhere. So check it out. Thank you.
Yeah, and
Thanks for
Siobhan,
giving me a
why,
plug.
and this is why I'm so appreciative is just because I know you help with the radio show and you help.
She did the music. That's her music that she did,
and
right?
it's your music, and we're just trying to put ourselves on the map. So I really appreciate your help in doing that. Thank you.
Thank you. Well, I appreciate everything you do. I've learned a lot from you, so you're amazing at what you do. And for everyone that's listening, it's been great to be a part of this and to get to know what you do and how you're changing lives and helping people.
Yeah,
Yeah.
it's a great opportunity. It's not even remotely what I thought I could do when I became a dentist. I thought that I would just be fixing things, but we're way beyond that.
Absolutely.
Yeah, I mean, it's like trying to, connect with the public and let them know that there's so much that can be done by just like you said something, I think it was during the last segment about, when I look into their mouth, I see something's gone awry or something's not right. And I wanted to ask you, what is it that you're seeing visually with your eyes? What are you actually seeing?
Well, we typically see when we do some of our basic science or when we do some of our basic data gathering, we'll see either black spots on the teeth. We'll see a lot of abundant, what we call biofilm. We used to call it plaque on the teeth. You'll see bleeding gums. That's really common. You'll see black triangles between the teeth. You'll have a patient with significantly bad breath. You'll have people that have drifting or flaring teeth, teeth that are not aligned or positioned properly. And we know that, they used to be positioned properly, but now they're drifting or they're kind of getting out of line. So it's pretty amazing the things that we can see that alert us that maybe just something's not right. And then we can take it further from there. And the modern science has allowed us great opportunities to do that.
Yeah, it's pretty amazing. Welcome back to this special edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin. We are talking with Dr. Thompson, dentist and pioneer in prevention from Bloomfield Hills, Michigan. He's here tonight explaining the medical diagnostic model he incorporates in his clinic to screen for many of the catastrophic diseases from cardiac disease to Alzheimer's that through early detection can be prevented. If you have a question for the doctor on the topics we're discussing tonight, please give us a call at 800-859-0957. And before we come back to Dr. Thompson, I'm going to encourage the Tuesday night listeners to tune into his weekly show, Sunday at 3 p.m. You'll certainly get a lot more information there. And most of those shows are also live, giving you all listeners the opportunity to call in. And I must say, it is really a really rare opportunity to be, because we can't reach our own doctors. We can't get through to our own doctors. We can't get past the front line of people that answer the phone. And it's like, what's wrong with you today? Why are you coming in? You're making an appointment to come in. There's no way that you can call and get through to a doctor, a dentist directly to be able to ask them, any of the questions that you're here like the Encyclopedia Britannica tonight, just, giving answers to everybody. But I think that it is a tremendous opportunity for people to realize that your PCP, your primary care physician, the doctor that you're going to see, if you can get in to see that doctor, is going to be seeing you for what's hurting you today. And unfortunately, all these catastrophic diseases now, through the advances in bacteriology and diagnostic technology, that dentists like yourself, and there are very few of you who are doing what you do. I mean, there's very few of you, and we're lucky to have you here. We're lucky that you do this. And for the listeners, please tell us a little bit more about when you're looking in the oral cavity, what other tests are you doing that are crucial? And certainly I'm going to put it out there. We talked about Alzheimer's. We've talked about dementia. These pathogens can be found in the oral cavity. But let's talk about another great fear, aside from cancer, is obviously heart disease.
Yeah, well, it all starts with analyzing what kind of bacteria live in your mouth. So if I see bleeding gums, if I see black spots on the teeth, if I see flaring teeth, if I see black triangles between the teeth, if I see if someone has notoriously bad breath, and believe me, if you have bad breath, it's probably not your fault. There's probably something going on in your mouth that's causing that bad breath. or something going on in your stomach that's causing that bad breath. So if you have a loved one that's telling you, "Oh my gosh, your breath is bad," or it's a little bit offensive, you shouldn't take it personal. You should take it as a warning sign that maybe something's not correct. Because if it's not correct or it's not in the right balance, then that's a problem. So one of the things that we want to do, Anne Marie, is be very, very aware of these conditions that would alert us that maybe we could order just a simple test, a simple saliva test, and look at the certain pathogens or bacteria that live in your mouth. And, this is research that we didn't know that many years ago about how these certain bugs can totally change your trajectory of health. And what the listening audience should know is let's just try to make it really, really simple. If you have a wrong kind of bugs that live in your mouth, it can affect the health of your vessels. Now, when I say vessels, I'm talking about your blood vessels. You probably have 60,000 miles of blood vessels that run in your body. So if you have problems with bacteria that can affect the health of your blood vessels, then surely they're going to affect the health of all the blood vessels around your heart, and they're going to affect the blood vessels around your brain. So if they affect the blood vessels around your heart, we have traditionally known that as heart disease. So does the mouth have an impact on heart disease? Oh, you bet it does. You bet it does. If you have the wrong kind of bacteria in your mouth, it's going to affect the vessels that feed your heart blood, that keeps your heart working beautifully, and you could have what we call heart disease. What I didn't know and what I never expected that would ever come true is that I could do something therapeutically in the mouth that would either stall the progression of that disease or help the healing of that disease, or maybe I could even network with a cardiologist, like I know one of the big guys on your program, Dr. Colander, and we have other people in our area that commit to getting their message out. I mean, it's amazing what we can do when we have these patients that are seeing both a physician and us to help. And one of the unique things is if you go to your medical doctor doesn't have a dental hygienist on staff that could help you determine if you have that kind of disease.
Mhm.
Only we as dentists can identify that. And one of the things that I wanted to share with our listening audience when I heard your discussion is I'm available to them. When someone comes to my practice and they pay me for an exam, I give them my business card with my cell phone number on it.
Wow, that's pretty
So
amazing.
I want them
That's-
to know they
It's
can
like very amazing.
I want them to know they can contact me and I can put them in touch with people around the world that can help them be healthier. And that's the idea. And that's what most people, we're building a big network of people that can help other people, but I don't want to be inaccessible to them. I want to be accessible to them. So when you said in the intro to this segment that, you can't get to your doctor or you can't get to your dentist, you can get to us. If you come and see Dr. Watkins or I, my colleague, you will get our cell phone number and we will help you.
That's pretty amazing. I want to talk some more about that, but Siobhan's got a caller.
Yeah, we do. We have David from Windsor on the line. David, what's your question?
Yes, the question for the doctor I'd like to find out too, like about abscesses. What are the things? How long don't you think that it would be a good idea to have an abscess treated right away, then to let it drag on for long periods of time to the point where it proves fatal to any abscess? And what are the best treatments for abscesses once they find out? And don't you think that would be one of the big leading causes of oral and diseases throughout the entire body?
Yeah, David, first off, I want to thank you for being a repeat caller. You called me on a show when we talked from Gary from Chelsea, and we talked about another topic about fluoride. So I really want to thank you for being a repeat listener. So you know what that tells me? It tells me the show must be interesting. So thank you for being a repeat listener and calling us from Windsor. But yeah, there's no question that if you have a dental abscess, David, what you're alluding to is when you have a root canal or when you have a tooth that basically dies, the nerve of that tooth dies in your body. As soon as any kind of foreign substance enters your body says, whoa, 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 that's not normal. Something's not right. And so we develop a big immune response. Our body starts to say, let's go on defense. Let's get rid of that bad tooth. And what happens is you develop an abscess. And an abscess can be cured or stabilized by what we call a root canal. It's removing the dead nerve of the tooth. That's what's really important. And we remove the dead nerve of the tooth, and then we stabilize the infection, basically so it doesn't affect your systemic health. And then that mitigates the risk from that abscess. I will tell you there's two major risk factors for systemic infection: gum disease and periapical, or what we call root canal type diseases, and that's what you're alluding to. So I'm a big fan of getting those things addressed right away, very prudently. And if I see anybody, I had somebody today, Gary, that drove 7 hours to come to my practice to have an evaluation, and they had a problem around one of the root ends of their teeth, and I referred them immediately to somebody who could help me identify what that is. That should be taken care of immediately. It's very dangerous to have a root end infection that's non-diagnosed, that's non-treated, and you want to get that taken care of immediately. It's a brilliant question, and it's a very, very important thing to take care of. We have specialists, and we can help with that. But I really appreciate your call, and that's a very serious issue to talk about. We call that endodontic or root end disease. It's a very, very important thing to take care of. If anybody's ever had a root canal in the listening audience, they know how painful that can bring a guy that can, bench press or deadlift 650 pounds to his knees. It's so painful. So we want to make sure that we get that taken care of if anybody has that kind of infection.
Well, let's come back and talk some more on the other side of the break. In the meantime, you're listening to the Dr. Douglas Thompson radio show, and we are talking about oral health and disease prevention. If you have a question, you can reach the doctor by calling 800-859-0957. Again, that number is 800-859-0957. You won't want to miss this chance to talk to the doctor directly. You're listening to the Dr. Thompson radio show on 760 WJR. And we are back on Facebook.
Yeah, I really appreciate people like David who are tuning into the show regularly, and they're kind of thinking about this whole thing, because you can't get the gist of it in one segment. And
no, you can't get the gist of it sometimes in several weeks or several months.
It's a lot. There's so much.
It's a whole, it's a whole paradigm change. It's getting people to realize that, through the latest discoveries and, being able to analyze pathogens that are in your mouth, and that they are connected to diseases that you may get later. Why do you want to wait till you have to go see your doctor because you've got chest pains, or, you're feeling sick, or you're feeling languished, and you're obviously there's something wrong with you. Now you go to make an appointment to see your doctor. You've already got the disease. And with Alzheimer's, you can't turn it back. There's no cure for Alzheimer's. There's no cure for dementia. There's nothing you can do about it except live whatever's the rest of your life out.
Talk about no cure. David mentioned this abscess. I've had people in my practice that have ended up in urgent care, went on to ICU, and didn't come out of the hospital. You know what that means? From root end infections. They died.
Are you serious?
I'm totally serious.
My God.
It's a very, very serious infection. So, playing around with this in our practice, you come into our practice and you have a dental infection, I will tell you to your face that this could be potentially life-threatening if you don't get it taken care of. And I can't tell you who's who, because our bodies have, how many people, we all know some people get COVID, it's like a cold.
Right.
It's like a cold. Mm-hmm. Other people get COVID, they end up in ICU and they go on a ventilator and they don't make it out of the hospital.
Right.
Why is that? Why is that? Because these diseases affect us all differently, and dental disease is a serious, serious infection. And I'm not going to play around with it. If you have that infection, you come to my practice, I'm going to make sure you get help.
And immediately. And I do want to tell a quick story. A friend of mine who works for Ford Motor called me and said that his wife, their dentist had retired, and his wife was suffering from an infected upper molar, that she went to the endodontist, didn't need a root canal, but definitely had an infection. And he wound up calling 8 different dental practices from recommendations of friends and colleagues. They all said the same thing. We can see you in 3 months, 2 months, 1 month.
No.
But I mean, this is when he called. This is an emergency. She was taking Tylenol 3. She's using codeine to kill the pain. Obviously, an infection. The endodontist said the tooth needs to come out. And then he's lost. And he's trying to call and get an appointment with a new dental practice. And they're all saying, yes, we'll see you in how about 3 weeks? How about 3 months?
Not acceptable.
Yeah, I know. And here you are. You're handing out your cell phone.
Yeah,
Okay.
totally,
I mean,
totally.
people have to wake up and realize they need to take care of this stuff right away.
No,
But anyway.
these infections are
Are serious.
very serious, and they're gonna and it'll come out. It'll come out in the science as years ahead. There will be a time where people will respect and appreciate what the dentist can do for them, and we might even be renamed. I mean, we might,
Right.
our title might even be
No,
renamed.
I mean, you're definitely
But
medical dentist. There's a difference.
We are way on the early end of this, but
Right.
people need to realize that we can do this now. I mean,
Right, exactly.
You don't have to wait 20 years. We can do
Right.
it now.
Exactly.
But it'll be a long time for the public to catch up,
Right.
for sure.
Welcome back to this last segment of this special live edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Thompson about his state-of-the-art clinic and his practice of prevention. This is our final segment, so if you have a question for the doctor on the topics we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. So, Dr. Thompson, here we are. We're at our last segment, and we can't stress the importance of listeners realizing that so much of disease starts in the oral cavity. And let's face it, your doctor is not asking you to open your mouth. They're not doing swabs of your mouth. They're not examining the oral cavity. When you go in for your annual physical, it's, take a few lab blood tests, stress test, EKG, whatever, pulse and the normal diagnostic test to look for if there's anything wrong with you today. But this whole arena, this whole world that has opened up, and I would say in the past 10 years?
Yeah. And, one of the things I would say is if you want to know if you have a good physician or not, is some of these, some of the physicians, we've been networking now for 10 years with physicians. And if your physician asks you to open your mouth and stick out your tongue and look at your teeth and look at your throat, I mean, that's a physician that's already looking at more than what even traditionally they've done, because a lot of times they've just left your lips closed. They haven't even looked in your mouth. So I want to make sure we give credibility to our physicians who are aware of the idea. But let's make no mistake, nobody other than us can really thoroughly diagnose what's going on in the mouth. Nobody other than us can thoroughly diagnose what's going on in the mouth. So in your physician's office, they would love to be able to do that. They just don't have the capability. They don't have dental therapists. They don't have dental hygienists. They don't have the kind of support staff or tools or instruments even to be able to identify
Well, they're
what's
not
happening.
taking swabs of your saliva.
No.
Let's face it, you have to look into the oral cavity, take a swab out, and then look under a microscope and see what's growing there. And then further to that, are you sending it out for DNA testing, or what happens when you take the swab?
What happens is it's usually a swish. It's just basically collect some saliva sample, so people can rinse with something, and they can give us back that rinse, and we can they can just rinse easily with their mouth and swish around for 30 seconds and give us that sample back. We can send it into a testing lab within even as short as sometimes 3 days. We can get back that information that tells us what kind of pathogens are living there. And if you have high levels of high-risk pathogens, and when I say high-risk pathogens, I mean we're talking about bacteria, yeast, or viruses that has good scientific backing, that if you have high levels of these, it's not going to be helpful for your health, or it's going to be harmful for your health. And if you have that, then what my job is, and what my dental hygienist job is, and my dental assistant's job is, and actually Joe's sitting in the studio with us tonight. He's a dental assistant in my practice. I mean, these people all come together. All of us come together, and we want to figure out, how do we create a plan How do we create a plan to help you stabilize or get rid of these harmful bacteria so they don't go on to affect your systemic health? And what the good news is we can figure out a plan to control these one time in your life, and we can actually help you stabilize these for years of your ongoing life and eliminate your exposure to those. And it's long-term exposure to high-risk bugs that cause the problem for you over your lifetime. And if I could eliminate that, what a great service for you, and what a great service for your family. Because one of the things you never mentioned, Anne-Marie, and you've never talked to me about is what happens if you have these high-risk pathogens and you're kissing somebody in your family. Do you know these are transmissible?
I would imagine that they are. I mean, pathogens are going from saliva to saliva, right?
I have husbands and wives that have the almost exact
Well,
same
sure.
saliva makeup. So even if we're having a hard time controlling somebody's bacterial makeup, the first thing I want to say is, who's your significant other? Tell me how healthy are they? How about college kids that never had a cavity in their life, and they go off to college, and pretty soon, 2 years later, they have these cavities? And my first question is there been some other access to different saliva than what you've been used to for the last 20 years? I mean, these diseases are fascinating if you think about how they happen, how they grow, and what happens in the family. So to the next point, what about the young mom? What about the young expecting mom that has gum disease, that has cavities, and thinks, oh, I can't afford a dentist, or I just want to eat convenience foods and drink sugary drinks, and I have a few cavities, no big deal. Well, you know what? When you have that little newborn, guess what's going to happen to the little baby, and where are those bacteria coming from? It's going to come from kissing, sharing a spoon, sharing a cup, that kind of thing. So we actually have a saliva test now for expectant mothers and for people that are going to think about family planning. So there's so many avenues of things we could talk about of how oral pathogens, whether it's preventing cognitive decline in your 40s to your 80s, or whether it's preventing cavities and other problems in your young-born baby. I mean, we can go from both ends of the spectrum. It's amazing. And
I
we
think-
do all of that.
And the fact is, you do have a very super specialized practice, because not all dentists are, unfortunately, they're not all doing it. You're in the business of preventing the major diseases of our time. But I also want listeners to know that Dr. Thompson has a very wide network of other dentists. If you don't live here, if you're listening from another state, you've got dentists that are connected to and practicing the same type of practice that you do all over the country.
We do. We have a network of dentists. I didn't intend to talk about this tonight, but I mean, and I'm basically the person who put this together. It's called the Wellness Dentistry Network. And if you went to wellnessdentistrynetwork.com, you could find a dentist all over the world. We have dentists in New Zealand. We have dentists in Spain. We have dentists in England, Canada, all over the United States. And these are all dentists that have, Anne-Marie, all I would say about these dentists is they have heard the concepts. They're not new to salivary diagnostics, or they're not new to saliva testing. They're not new to bacterial sampling of the mouth. And they're very aware. And I can tell you, this is the future for dentistry.
Oh,
This is the future. It's not going to be your average mall dentist. I mean, I get that your average mall dentist serves a purpose. But let me tell you, if you want to be healthy, and you want to think about avoiding some of the major diseases of our time, it's going to be a good idea to get to a Wellness Dentistry Network dentist somewhere. And so if you go to wellnessdentistrynetwork.com, you can see a directory of who those people are. And I have no financial interest in, promoting them. I can just tell you, these are smart people who are on the forefront of learning about this concept that we've been talking about for now weeks on this radio show, and I hope to do it for weeks more.
Absolutely. We can't stress the importance of realizing that you're only going to find out about these diseases from your dentist, the prevention of these diseases from your dentist, and that you need to find a dentist who is in the business of being in prevention and who does the type of diagnostic testing that you're doing.
Well, in the closing comments, I would just want to say, please look up one of us. You can come and see me in Bloomfield Hills, Michigan. We would love to see you. I have people that have flown all the way from Belgium to come and see me, and I would love to help people understand their oral conditions more and how their oral conditions not only could affect their systemic health, but how it could prevent some major diseases that could cause a lot of trauma in their lives.
It's not just about living longer, it's about living well while you're living longer. Unfortunately, we're out of time, and that wraps it up for the Dr. Thompson radio show on 760 WJR, sponsored by Integrative Oral Medicine. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Thompson for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed oral pathogens. To learn more about Dr. Thompson's practice, you can reach him directly at 248-642-1000. Again, that number is 248-642-1000, or by visiting him on the web at ioralmed.com. Again, that's ioralmed.com. We hope you enjoyed this special show and that you've become more informed about oral health and its impact on the major diseases of our time. Thank you also to my co-host, Siobhan Cronin. Good night, and thank you for listening. Be well.
Thanks,
Great,
Siobhan.
show. Sorry I couldn't make it early enough, but
You made
it
it.
sounded awesome.
It was great. You made it